Health authorities in Ethiopia are on high alert, investigating a cluster of suspected viral hemorrhagic fever cases in the country's South Ethiopia region. This is a developing situation, so let's break down what we know so far, what's being done, and why this is a significant health concern. Viral hemorrhagic fevers, or they're a group of illnesses caused by several different virus families. You've probably heard of some of the most serious ones: Ebola, Marburg, Lassa fever, and Crimean Congo hemorrhagic fever. These diseases are known for being severe and are often associated with high fatality rates. What makes them particularly dangerous is their potential to spread, causing large-scale epidemics. So, what happened in Ethiopia? So far, 8 suspected cases have been reported. Now, the term suspected is key here. It means these individuals are showing symptoms consistent with a viral hemorrhagic fever, but laboratory confirmation is still needed to identify the exact virus responsible. These initial symptoms can be quite general, often starting with things like a high fever, extreme fatigue, dizziness, muscle aches, and a general feeling of weakness. As the illness progresses, more severe symptoms can develop, which can affect multiple organ systems and, in some cases, lead to bleeding, which is where the term hemorrhagic comes from. The samples from these patients have been sent to the Ethiopia Public Health Institute, which is the national reference laboratory. Their experts are working around the clock to analyze the samples and pinpoint the exact cause of the infection. This is a critical step because knowing the specific virus is essential for tailoring the response. Different VHFs have different transmission routes, treatments, and control measures. For example, some spread primarily through contact with infected animals, like bats or rodents, while others can spread from person to person through direct contact with bodily fluids. Given the potential severity of the situation, the response has been swift. Ethiopian health authorities are leading the charge, implementing immediate control measures and ramping up surveillance in the affected areas. They are not waiting for lab results to act. The protocol for a suspected VHF outbreak is to notify authorities and begin response activities immediately. This proactive approach is crucial for containing a potential outbreak before it can spread further. The international community is also stepping in to provide supports. The World Health Organization, or WHO, has been a key partner. They are deploying an initial rapid response team to the region. This isn't just 1 or 2 people. It's a multidisciplinary team of 11 technical experts. These are seasoned professionals with experience in handling exactly these kinds of outbreaks. Their expertise covers a wide range of critical areas. Let's look at what these experts do. Some specialize in disease surveillance and investigation. Their job is to work with local teams to trace contacts, identify other potential cases, and understand how the illness might be spreading. This is detective work, and it's fundamental to stopping transmission. Others are experts in laboratory testing, helping to ensure that samples are collected, transported, and analyzed safely and accurately. Then you have specialists in infection prevention and control, or IPC. They work in healthcare facilities to ensure that health workers are protected and that the disease does unspread within the hospital setting. This involves setting up proper protocols, training staff, and making sure they have the necessary protective gear. Clinical care experts are also part of the team, providing guidance on how to best manage and treat patients to improve their chances of survival. Coordination is another huge piece of the puzzle. An outbreak response involves many different partners of the government, local health facilities, international organizations, and the community itself. WHO experts help coordinate all these moving parts to ensure everyone is working together effectively and efficiently. Finally, and perhaps most importantly, there are specialists in community engagement. Building trust and communicating clearly with the local population is essential. People need to understand the risks, how to protect themselves, and why certain public health measures like isolation or safe burial practices are necessary. Without community cooperation, it's almost impossible to control an outbreak. Beyond personnel, who is also providing critical supplies, they are sending personal protective equipment, or PPE, for health workers. This includes gowns, gloves, masks, and eye protection, all essential for preventing transmission in healthcare settings. Infection prevention supplies, like disinfectants, are also being delivered. One of the most significant pieces of equipment being sent is a rapidly deployable isolation tent. This can be set up quickly to create a dedicated space for treating patients, bolstering the local capacity to manage cases safely and effectively. To fund these immediate response activities, WHO has released $300,000 from its contingency fund for emergencies. This fund is designed specifically for situations like this, allowing the organization to deploy resources quickly without waiting for traditional funding cycles. This immediate injection of cash is vital for getting the response off the ground. So, why the major response for just 8 suspected cases? It's all about the precautionary principle with viral hemorrhagic fevers. The potential for rapid and widespread transmission is a serious threat. The goal is always to get ahead of the curve by responding aggressively at the first sign of a potential outbreak. Health authorities aim to contain it at its source. A small, localized cluster of cases is much easier to manage than a large, widespread epidemic. We've seen in past outbreaks, like the West Africa Ebola epidemic from 2014 to 2016, how devastating these viruses can be if they are not controlled early. The health and safety of the local communities and the brave health workers on the front lines are the top priority. The collaboration between the Ethiopian government and international partners like WHO is a powerful example of global health security in action. The coming days will be crucial as laboratory results come in and the response on the ground continues to scale up. We will be monitoring this situation closely and will bring you updates as more information becomes available. It's a reminder of how interconnected our world is and why strong public health systems and international cooperation are so vital for protecting us all from infectious disease threats. Thank you for watching. If you found this information helpful, please consider subscribing for more updates on global health and science. Stay safe and stay informed.